The most exciting advances to me is that everyone is looking at it at different angles. There isn't really one that's most exciting because you don't know which one will win in the end. But the fact of the matter is we are beyond symptomatic therapy in Parkinson's disease. We are now looking at agents that can slow disease progression. We are looking at ways to diagnose it more accurately. We are looking at markers that will help us track progression so that when we do investigate on new therapies, we rely on more precise measurements as compared to just clinically looking at the patient and assessing the patient. So if you think about it, in Parkinson's disease, when there's a new drug out there, the only way I can prove it is to ask the patient, tap your thumb and index finger, open and close your hand, and the person who taps it quicker and open and closes their hand a little bit faster on a certain drug wins. That means the drug works. But you know that doing these things are subjective, and I will have to measure, do this in 100, 200, 300 patients, because this is very subjective. It depends on how you woke up, on your motivation and stuff like that. But think about it in a different way. If you have a disease like high blood pressure or diabetes, they can check blood sugar. Blood sugar doesn't lie, and therefore you only need a handful of diabetics to show that the drug works or not, whereas you need a lot more in Parkinson's because we don't have that test. Once we have that test, then we can more efficiently really investigate interventions, drugs and whatnot, in a more accurate way, because we have a marker, we have a test that tells us it's working, it's not working, and not just doing this. So that's exciting to me. And then the therapies we're looking at now are more targeted to the pathology of the disease. What do I mean by this? Is that because we are now understanding what's going on in Parkinson's disease, the medications we're testing target the exact pathology. Prior to that, the medications we were testing were more kind of symptomatic global therapies. It's almost like if you have a headache, the drugs that we were testing were, ibuprofen and acetaminophen or things like that. That they're very generic, general medications that will improve the headache. Now we're looking at drugs that will prevent the headache to begin with, or address the pathology of the headache. So that's where we are in the stage of Parkinson's, that our options are much more specific as opposed to a general symptomatic therapy. So lots of things are going on. I don't know which one will be more successful than the other, but the fact that we now have so many things and so many options and so many reasons to succeed excites me the most. I think this is a special meeting because you have the world's best and brightest speakers, thought leaders, researchers in this meeting, but the setting is a bit more intimate than an academy meeting with 10,000 people. So it's a large meeting, but it's manageable. It's like choosing a city that's not Paris or New York, but something more livable and walkable, and you could appreciate it a bit more. So the city, Lyon in France, is just kind of a good representation of the size of this meeting. It's beautiful, it's world-class, just like Paris, but it's more intimate than Paris. So that's our meeting. So you have a better networking. We have a lot of trainees, and they have more one-to-one conversations with thought leaders and the best and brightest in the world that they wouldn't have had a chance in a much bigger meeting. The highlights of the meeting is that the program itself, I believe, really tried to blend the bread and butter educational conferences that's really beneficial for a student just starting to learn about Parkinson's and movement disorders, and that of updates and new technologies for the seasoned clinician. So the highlight of the meeting for me is that it was able to kind of satisfy both the needs of a seasoned clinician to that of a curious, enthusiastic trainee. And they're there together, they're both appreciating it. The educational opportunities they have, the coffee with the professor, the one-is-to-one, opportunities they have, the controversies. We'd had a lot of debates in this Congress, so that's really a good highlight that I would always remember. And so yeah, I mean, I'm very happy it turned out very well.